Is it possible to have microneedling treatment on the neck and near the eyes? Is it dangerous to have this treatment on the neck and near the eyes?
Thank you for your question. You're asking, is it possible to have microneedling on the neck and near the eyes? Well, I could certainly give you some guidance on this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been practicing in Manhattan and Long Island for over 20 years. I'm part of the Vampire Facelift Network of doctors for many years now. I've actually been called upon by the media to comment on the Vampire Facial when certain celebrities underwent this procedure. So microneedling is a part of what we do in our practice, and I think it's really important to be educated about the benefits of microneedling, which is often misinterpreted. So to begin with, first of all, in terms of the question of safety, is it safe? It is safe, but with microneedling, you have to understand there are different levels of depth. Microneedling can be superficial, it can be limited to the epidermis, and it can also go down to the dermis. So the real question is what are you trying to achieve? If you're trying to improve under eye skin quality, then in our practice we routinely will use modalities that include platelet-rich plasma, the use of fractional CO2 laser, the use of radiofrequency like Pelleve. For the neck skin, similarly, we'll use platelet-rich plasma to improve skin texture and quality. We've even been able to help scars in the neck with the use of platelet-rich plasma. The use of topicals in the retinol family, light laser treatments. So microneedling is a good treatment, but you have to question, like, what are you trying to achieve? If you're trying to achieve tightening of the skin by creating the tiny holes, I think there's value, but there is still an upper limit. Creating these puncture holes in the skin has to be done in a way where the skin heals in a way that's advantageous. I find that as of late, there is often an overzealous use of modalities that have an appropriate use, whether it's radiofrequency, whether it's laser, whether it's microneedling. Patients are coming to me more and more with concerns because they feel that they've lost volume, they've lost tissue from aggressive use of any of these modalities. So to answer the question, the answer is yes, but microneedling is not a generic procedure, especially when combined with the Vampire Facial or the use of platelet-rich plasma. You want to essentially penetrate the skin up to a certain level and then apply the platelet-rich plasma in a way that gets absorbed and stimulates collagen, blood supply, and the things that platelet-rich plasma does. Just for clarification, platelet-rich plasma is a derivation of your own blood, which is spun down, and a concentration of the healing factors and growth factors are used and applied to help improve the areas that you want to improve. So in our practice, we use it for under-eye dark circles, we use it for acne scars, we use it for scars, we use it for complexion improvement. So it's remarkable. We even use it in combination with acellular matrix for hair loss. So there is an art to all of this treatment, and unfortunately a lot of times people are finding practitioners, whether they're non-physicians or people who have limited scope, and they're sometimes just getting a little too over-aggressive, so you have to be careful. So with that being said, again, in summary, it is safe depending on the depth, depending on the method, also depending on the indication. A lot of people will search for a procedure assuming it's the right procedure for the concern they have. So when I tell people who come to us maybe with an interest in microneedling, I say, okay, let's put that aside for a moment and let's first figure out what are we trying to improve. And you'll be surprised to see how many times we actually find a better alternative to whatever it is they think they need, but at least often you're on the right path because you want to maybe improve fine lines, wrinkles, discolorations, and scars. So I hope that was helpful. I wish you the best of luck, and thank you for your question.